Hello and welcome to The Excerpt. I'm Dana Taylor. The brazen murder of UnitedHealthcare CEO Brian Thompson in broad daylight in midtown Manhattan last year has opened the floodgates to an outpouring of anger and frustration with the health insurance industry. Across the country, whether it's about skyrocketing financial costs or access to care, there seems to be a wide agreement that health insurance in America is broken. The question is how to fix it. How can policy incentivize the industry to be better stewards of the health of its members without fueling unsustainable costs or incentivizing waste? What solutions are on the table and how might they shape the future of healthcare in America? Here to help us dig into the details is Vivian Ho, the James A. Baker III Institute Chair in Health Economics at Rice University. Thanks for joining me, Vivian.
Thank you for including me.
Vivian, Americans' collective frustration with the healthcare insurance industry rose to a fever pitch following the murder of UnitedHealthcare CEO Brian Thompson. How did we get here?
Well, this situation has been brewing for years. Anybody who's had a health insurance policy and has had to deal with trying to get access to a diagnostic test or an important treatment for their care has dealt with the frustrations of the health insurance industry, seeing denials of their service, spending huge amounts of time on the phone, contacting both their provider and the insurance company trying to get approvals. People are frustrated and then getting bills, surprise bills that are much higher than they wanted to pay. And they're frustrated and they've been complaining. They've complained to policymakers. They've complained to the insurance companies. They complained to their employers. And everything has just bubbled up because nothing seems to work.
The whole country is a stakeholder in this debate encompassing not just patients and physicians, but political parties, the insurance industry, and big pharma, to name a few. And each has proposed its own solution. Let's start with Physicians for a National Health Program. What's the main thrust of their proposal, and is it likely to be considered during a new Trump administration?
So the Physicians for a National Health Program is proposing something very similar to Medicare for All, which has been proposed, for example, when Kamala Harris first ran for president. So what this proposal does is it's asking the federal government to pick up the cost of health insurance for, half of our country is getting health insurance through their employer. So currently the employer and the employee are paying for that health insurance. So it would be a huge increase in cost. I don't think it's likely to be picked up by the current administration simply because there are too many parties who are making too much money from the current healthcare system and have very powerful lobbyists who will be arguing against this system. So, for example, for many years until just recently, Pharma, the pharmaceutical companies, were the largest lobbyists in Washington, D.C. The American Hospital Association would be against this particular proposal. And even physicians, there are many physicians who would be against this particular proposal as well. The only people who might be in favor of it is patients who are having problems getting access to healthcare. But we also have data showing that most people who have employer-provided health insurance would rather stay with that than move to another option.
The Affordable Care Act, President Barack Obama's 2010 signature policy achievement, is really the last major legislation passed related to health care, and it just enjoyed its biggest month of signups ever last December. During President-elect Donald Trump's first term in office, he repeatedly vowed to replace it, but ultimately didn't have a plan for what should take its place. What do Republicans not like so much about the ACA marketplace, and are there any alternatives?
The Republicans have continually criticized the Affordable Care Act because it does result in tremendous federal expenditures. Yes, it's at record levels. The number of people who are uninsured under the Affordable Care Act has actually, I believe, doubled under the Biden administration. So over 20 million people have healthcare coverage. When you are covering that many people, it's a very strong burden on the federal budget. And the Republicans are interested in controlling spending. They want to reduce the budget. And so they are continually looking for proposals that will reduce that spending. And one of those is to weaken the provisions of the Affordable Care Act, cover a few people, sort of reduce the generosity of Medicaid. So that creates problems for many Americans who can't afford to buy healthcare insurance or get access to coverage. In terms of what the Republicans are trying to propose, there have been Republican senators who are making smart proposals to fight particular fires in the healthcare system. So, for example, we have a problem now with consolidation of healthcare systems that is allowing healthcare systems to charge what are called facility fees in doctors' offices, which they acquire. And that has led to tremendous increases in expenditures. There are also other Republicans that have been working towards gaining more price transparency. Under the first Trump administration, there was price transparency rules that were introduced to try and force hospitals and other providers and insurance companies to reveal the prices that are being paid for services, which would enable employers and employees to shop for their health care. That would be a good thing because American consumers are good at shopping when they can see the prices. The problem is that the prices have been revealed in some cases. There hasn't been enough enforcement by the Center for Medicare and Medicaid Services on transparency. So hospitals, some of them are complying, many are not complying. So it is impossible to shop right now. The other thing is none of the data has been standardized. So there are tremendous people who are very good at data science trying to make this data available to employers and other purchasers. But the problem is if none of it is uniform, it's impossible still to compare those prices to shop.
Have Democrats been able to offer any policy fixes that might have traction when all three branches of government will be Republican controlled?
I haven't heard of any proposals that would receive bipartisan support simply because the two political parties are so far away from each other. The Democrats are interested in trying to get access and insurance coverage to more Americans, in some cases, regardless of the cost, whereas the Republicans are very much focused on lowering the overall budget deficit.
Big Pharma is often blamed for escalating the cost of health care, and yet drug costs paid out by Medicare, by far the biggest customer here in the U.S., only recently was able to negotiate prices on just 10 drugs covered. Do regular healthcare insurers get to negotiate what they pay for drugs? How does this work in other countries?
Well, in other countries, the government actually plays a much larger role in negotiating prices and working as the largest buyer to get the consumer the best deal. The move towards allowing Medicare to negotiate prices here in the United States is the right first move. We should take advantage of the fact that the government is the largest buyer and negotiate the lowest price. The other thing that we should be demanding of the pharmaceutical manufacturers is much more transparency on the cost of the drugs that they are developing. So I understand that drug development is risky, but we can actually set a price for these drugs that's fair for the consumers, that covers the costs of R&D, but we shouldn't be paying excess well over. And yes, these companies in many cases should receive higher profit margins than, say, other industries where there is less risk. But unless we have information on how much those R&D costs are, we can't make a fair judgment of what the price should be. And that's partly why healthcare costs have been increasing so much.
Getting back to the healthcare insurance industry, insurers only make money when the cost of care that they deliver is less than the receipts by way of premiums they take in. They accomplish this by spreading the risk of unhealthy patients. But some critics of the industry have said that this approach only works when there are a lot of healthy people who balance it all out. Now that we're all living longer lives, there's more risk. Is the risk model truly viable anymore?
Economists have been dealing with risk and uncertainty in the context of insurance for decades. What we know from the data right now is that insurers in general are making positive profit margins. It's not clear that they are making excessive profit margins, except in the case of UnitedHealthcare, which has been shown to be dealing in all sorts of questionable practices. So, yes, the US population is getting sicker and we need to cover those costs. in the medical expenses and then in the course of the insurance. But the volatility, which is what leads to the additional risk premium, is not necessarily increasing. This is something that can be handled. It's a hard problem, but it can be handled by the market.
The public's vilification of the insurance industry and putting profit over care was recently captured by Wle Potter, a former VP at Cigna, who wrote an op-ed in the New York Times entitled, "I was a health insurance executive. What I saw made me quit." What were his arguments?
So Mr. Potter got frustrated by what he saw on the inside. He saw what was going on in terms of denials, and he saw meetings where the only interest was raising profits for Cigna as opposed to providing good quality care and coverage for his customers. And it's such a moving piece to see someone like that and how much stress that he went under, and realize that his career was just not worth it. And he didn't want to think of what he had done with his life in the context of what Cigna was pursuing.
And finally, Vivian, think tanks, the NGO world, and academia are also participants in the healthcare debate. What are some of the solutions that have been put forward?
There have been some academics out of Harvard University who have been proposing that we consider price caps, particularly for the highest price providers, those that are charging more than, say, 300% of Medicare. Those prices seem too high, and maybe we should consider that option. Some of the other things that I've been impressed with, Patient Rights Advocate is an organization that's pushing for more price transparency. And they're working, surprisingly, they have a story that's very consistent with CEOs who are very familiar with healthcare, such as Mark Cuban, and saying that the contracts underlying employer-provided health insurance include all sorts of side payments towards insurers for things that should not be included. So, for example, additional payouts to an insurance company for recouping expenses that shouldn't have been paid out to a provider, that the insurance company is actually getting an extra return for getting money back for the employer that they shouldn't have had to pay out in the first place. Also, there's many academics who are working with employers, trying to get employers to be more price sensitive in the benefits that they design. There's been a very promising research study that's been put out in the American Economic Journal, which has shown that if you introduce tiered pricing, so you just have a simple copay system for patients who are choosing which hospital to go for very expensive care, you can lower expenditures for hospital stays by 8.5%, just by making things simpler for the patient to choose, but actually price sensitive.
Vivian, thank you so much for being on the Excerpt.
Thank you.
Thanks for watching. I'm Dana Taylor. I'll see you next time.